Good morning, everyone, and welcome to Macquarie University. My name is Rana, and I'm the Senior Manager at Macquarie University. I will very quickly first take you through the webinar format. So I'm going to introduce you to Macquarie University. We will have the Executive Dean and Deputy Vice Chancellor, Medicine and Health, Professor Patrick McMill, who will take you through the health and medicine at Macquarie University, the unique vision and features, and the program snapshot of Doctor of Medicine. After that, we'll have admission requirement to the Macquarie MD program by Tanya Kinan. After that, we will hear it from a student, our current student at the Doctor of Medicine program, Queenie Tang, who will take you through the student perspective. And at the end, we will also have Q&A session, which will be hosted by Karen. So feel free to type in your questions when you have throughout the webinar, and we will try to answer them at the end of the same. To introduce you to Macquarie University, we are based in Sydney. So we are very proud to say that we are thoroughly international, distinctively Australian. It's a beautiful 126-hectare campus where we also have the Macquarie University Innovation Park District based, where we have more than 300 companies who sit with us. The university has been ranked among the top in the world as well as in Australia. So we've been ranked 49th as the most international university in last consecutive years. We have also been getting 5 QS stars in most of the areas like teaching, employability, research, internationalization, facilities, innovation, and access and specialist subjects. So a really good university to study at if you're thinking at studying in Australia, the Doctor of Medicine program. In terms of number of students, we have around 40,000 students on campus, come from over 100 countries. So almost 10,000 degrees are awarded each year. We have more than 150 student exchange partners from over 40 countries. So you also have an opportunity to explore the internationalization of the university. We're just 15 kilometers away from CBD. So that is where the Central Business District is located. Very accessible university because we have our own train station, the only Australian university having train station on campus, and the only Australian university having a private hospital on campus. So that is how we say we're so distinctively Australian. I will now hand it over to the Executive Dean of the Medical School, Professor Patrick, who will take you through the Doctor of Medicine program.
So welcome. My name is Patrick McNeil. I'm the Executive Dean of the Faculty of Medicine and Health Sciences of Macquarie's Medical School. So we're going to talk about the Macquarie MD. It's Australia's newest medical program, and I think you'll find it pretty interesting. If we go to the next slide. So Macquarie is a relatively young university compared to many in North America. It's a little over 50 years old. And it's changed a lot over that period of time. In the last decade, it's become very prominent because it's the only university in Australia that has its own clinical facilities on campus, its own hospital, its own clinic. And I know that's more common in North America with university hospitals, but it's quite unique in Australia. But what that means is if you're a student, that the place that you're learning is on campus. Many of your tutors, lecturers, professors will be either doctors who work in our hospital and clinic or researchers who work in our research institute. So that's a little picture of Macquarie University Hospital, which is on campus. If we keep just scrolling through, Professor Bruce Doughton is the president of the university. He's a physician. He trained in Australia, but did most of his postgraduate training in North America as a pediatrician. So there's a lot of strong commitment from the president of the university for the medical school here at Macquarie. So the vision of the Macquarie MD, as we've created it, is shown, is really to create something quite innovative. It's, this slide shows what we call graduate capability. So the Macquarie MD is what might be called an outcomes-based program. So when we designed that, instead of saying, well, what do students need to learn or how do they need to learn, we said, well, what does a Macquarie graduate look like? What, if you have a Macquarie MD, what do you look like? So this slide shows you the four things that will distinguish you. You'll be a scientist and a scholar. That's what you'd expect in a medical degree. You'll be a very capable clinician with clinical skills that is very patient focused. And one of the things about the Macquarie program is there's a greater focus on safety and quality, practicing it in a safe manner and being aware of your limitations and being aware of the issues with medical error, which has not been prominent in medical education programs. Macquarie has created a global medical program, and so the third capability that will distinguish you is that you'll be an engaged global citizen. And you'll do that not just through lectures and tutorials, but the experiences you will have in the program, as we'll talk about in a minute. And finally, you'll be what we call a professional, particularly recognizing that modern medical practice is not just being a good individual practitioner, but being part of the healthcare team and being able to recognize where you are in your career at any point in time, where you need to get to, what learnings you need to do, your limitations, your strengths. That's what we call reflective practitioner. So a couple of things about the Macquarie MD that's unique. The first is that you'll be learning within, as I said, our university-led academic health sciences centre, which we call MQ Health. MQ Health provides care from what we call primary care or family medicine, right through to specialty care. We have doctors who work for MQ Health who work in the area of family medicine, specialty medicine, surgery, medicine, and practice in our clinic, as well as practicing in our hospital. So that's the first thing. Just go back one slide. Yeah. As I said, there's a strong emphasis on healthcare systems, making sure you understand through your experiences that practice occurs within a system of health. And one of the ways we do that is to give you experience of 2 or 3 different health systems. So clearly you'll learn about the Australian healthcare system, but in your third year, you'll spend half of your time immersed in the Indian healthcare system at our partner hospital in Hyderabad, called Apollo Hospital. And in the 4th year, you'll have opportunities to learn in other health systems in other parts of the world, partly ones you choose and partly ones that we arrange, for example, including in North American hospitals. So this slide shows some of the key features. Learning within MQ Health, as I said, a global focus. We think the Macquarie MD is one of the first truly global MDs in the world. Some emerging now out of Europe, but it's certainly the first one for Australia. And from my reading, I don't think there's any North American MDs with the same sort of deep global experience. Clinical learning occurs from day one. We have a very modern simulation environment where you'll be learning your clinical skills in safe environments from generalist doctors who work in our family medicine clinic. And then in your second year, you'll go on and extend that learning with real patients in our clinic and hospital. One of the strengths of this program is you're in a community of only 60 students, about 60 students in each intake. So there is a very strong relationship between your tutors and your lecturers. The students we've already discovered this year, they are very closely bonded together. And that counts a lot versus being in a big 300 or 400 intake program, which many medical programs around the world have. So I think I'll cover that one. We just maybe flick through the next slide. Just a little bit about MQ Health. One of the centres of MQ Health is the Macquarie University Hospital, which is not a big hospital. It's a hospital that's fit for the sort of size of the medical student intake we take. It's about 150 beds. It has most medical specialties. It does not have an emergency room. It does not have obstetrics or paediatrics, and you do the learning in those specialty areas in one of our nearby big state-run hospitals called Royal North Shore Hospital. So MQ Health is a whole ecosystem. We have a pre-med program, college degree that prepares students for the Macquarie MD. We also employ medical graduates, or what we call medical interns here in Australia, in our clinical environment. And as I said, we have doctors who work across academia and clinical work in our enterprise. So it's a real healthcare environment which you'll be doing in medical degree. So the global focus I've mentioned, it's the first global MD in Australia. It's one of few in the world. We think that's pretty innovative. We've done it in response to really the feedback from students who want to have an international experience during their university education. And we've seen that not just in medicine, we see it in almost every area of university life. And when we look at the literature on medical students who have international experiences during their degrees, there is a lot of proven educational benefits for the students when they graduate. They're much more focused on global health issues. They have much greater cultural sensitivity. They have a greater focus on public health. And we believe by having these deep experiences that are quality controlled, they're accredited by our accrediting council, that it will be a much better experience than, for example, a student elective. So these are some slides of Apollo Hospital in Hyderabad. You may have some preconceptions about what healthcare is like in a country like India. You probably should put those preconceptions aside until you really experience them. India is a country of more than 1 billion people that has pulled nearly 300 million of their population out of poverty into middle class over a very rapid 30-year period. And so there's a number of very high quality private hospital groups in India. Now, the Apollo Hospital Group is one that was founded by an Indian physician who did his postgraduate training in Boston before he went back to India and established the Apollo Hospital Group. International standard healthcare, but available for most Indians who are employed. And a really rich experience that over a 20-week period in third year and then up to 16 weeks in fourth year on your MD program. So just a few slides on a snapshot of the program. It's a 4-year MD. It's an annual intake of 60 students. Roughly about 40 will be Australian citizens and about 20 will be international citizens. These are the fees per year in Australian dollars. Indicative. Some slight increases over the 4-year period, but only cost of living. And the program's accredited by our Australian Medical Council, which is similar to the North American accrediting bodies, and approved by the Medical Board of Australia. I'll just go through what the student experience will look like. So year one typically is 3 days per week face-to-face and 2 days of student-directed learning. There's some lectures. It's not a heavy face-to-face program. We tend to use our face-to-face time for interactive work rather than lectures. We have lectures. Not every student comes to lectures. Some of them access them online and learn that material that way. That's perfectly fine. We find that our students actually like a range of forms of presentation. There are a significant number of practical sessions, including wet anatomy sessions. We have a very extensive wet anatomy laboratory we use in our pre-med program, but we use some of it for our postgrad programs, our MD and our Doctor of Physiotherapy program. We use interactive small group work called team-based learning. We don't use problem-based learning. Team-based learning is more structured than problem-based learning, and much more interactive, but focused around real-world cases. So the program is integrated around real work, even though the units are divided into medical sciences, clinical practice, and professional care. On your non-face-to-face days, you'll be allocated with one of our Doctor of Physiotherapy students to meet up with volunteer patients, volunteers in the community who have health issues. And that we have found is a particularly valuable way to develop your interpersonal communication skills in your own time that you arrange with the volunteers. So we'll go to the next slide to Year 2. Year 2 is where you have real health experiences in Macquarie University Hospital and Clinic. It's based around the way we arrange our clinical care, our clinical programs in our clinical environment. Mostly it's a body system based arrangement, as you can see there on the slide. You'll be divided into thirds and rotate through 3 units in different orders. There's a final unit in Year 2 of 6 weeks where you all come together and the focus is patient safety and quality research methodology. You will be doing a research project in Year 3, and the end of Year 2 is finalising what that project will be and making sure you're all prepared for that. So in Year 3, we call this core clinical placements, or what you might call clerkships, where you're attached to real teams of work through the core disciplines of internal medicine, surgery, primary care or family medicine, and then paediatrics and OBGYN. You'll do 2 rotations of those. You'll do, they're each of 4 weeks each. You'll do 5 rotations in a row in different orders over 20 weeks. And half of you will do that in Sydney, Australia, and half of you will do it in Hyderabad, India, and then you'll swap around. So the whole cohort will experience both environments, either first, second, or second, first. And when you are doing, say, for example, internal medicine in India, you'll be connected with the 6 students who are doing internal medicine in Sydney to compare and contrast the way cases presented and are treated. So if you move on to Year 4, Year 4 is very flexible. It's been designed a lot like North American MD programs, where you can choose the focus you want to put into through a range of what we call selectives, where we offer some additional clinical placements, and you can choose ones or you can elect ones that you want to try to get into. You can also do an elective. The only prescribed placements in Year 4 are 4 weeks of emergency medicine and 4 weeks of mental health, which we will arrange at, as I said, our North Shore Hospital, which is our large state-run hospital close by the university. And really, you can do those selectives anywhere in the world. In fact, we're about to sign a student exchange agreement with a very well-known North American medical school, which will provide opportunities for their students to come to Macquarie and our students to spend a selective or an elective in a North American medical school. All right, so I'll pass over to Tanya, who's our Student Services Manager, to talk to you about, if you're really interested now, hopefully you are, how you would apply to our program.
Hello everybody, I'm Tanya Canning, that's what our executive team just said. So I'm just going to talk to you a little bit about admissions, about how you get into the Doctor of Medicine program. So, as you're probably aware, we do like you to have a bachelor's degree, and we like this to be complete by the 31st of December. which obviously shouldn't be a problem. In terms of your GPA, we're looking for a minimum weighted GPA of 5 out of 7 or equivalent. In many cases, we find that applicants have a GPA which is much higher than this, but hopefully you're interested and you will apply and submit your GPA to us. In terms of the medical admissions test, there is a GAMSAT or an MCAT test which you'll need to sit. Now for the GAMSAT score, we're looking for 50, a score of 50 overall and 50 in each section. And that's each of the 3 sections. If you're taking the MCAT, many of you in North America will be taking the MCAT test. We're really looking for an overall score of 500 and a minimum of 125 in each of the sections. So moving on to IELTS, in line with professional requirements, we are looking for an IELTS of 7 overall and 7 in each band. And this is partly for visa purposes, but obviously that's not normally a problem for North American students at all. Now we also look for some prerequisites, so we're looking for human anatomy and human physiology. Now if you're not sure whether you meet those requirements, please do email us at medicine@mq.edu.au, and we can actually give you an assessment of those prerequisites. So don't worry if you're not sure whether you've got that in your transcript, we can look into that for you. Now as part of the application process, we do ask for a personal statement. Now this is really to see if you're ready for the international clinical placements in India and in North America. And indeed you can study globally in your 4th year if you wish. So the personal statement is really to see, are you ready, are you prepared for that? So that's why we ask for it as part of your application process. Now another key part of the application process to the Macquarie MD is our multiple mini interview. Now some of you will be thinking, well, what is that? Obviously you can Google it and see what it is, but basically it's a mini medicine interview. And for our international applicants, we have 4 stations that you will need to go through. So in those stations we'll be testing the qualities that we're looking for in medicine students. And we normally do this via Skype or via Zoom, and we try and do it at a time that is suitable for North American applicants. So it is a competitive performance, but many students who do it actually find it very kind of enjoyable, and some of them find it quite an interesting process to go through. So I want to sort of demystify that. Sometimes people can be quite worried about interviews, but it is actually quite a positive process to go through, and it is testing those skills that we're looking for in future medicine students. So moving on to how you get selected for interview. When we're looking at candidates, we do take into account 50% is based on the GPA and 50% is based on the GAMSAT or the MCAT. So that's selection for interview. In terms of selection for an offer, we do actually look at people's ranking, and then we rank people for offer based on the MCAT score or the GAMSAT score and the interview performance. That's the MLI performance. And we'll only really look at the GPA if there's a sort of candidates that are equally matched. So that's a bit about our admissions process. Hopefully you will ask us some questions about that if you do have any questions. Okay.
Hi, I'm Queenie. I'm a first year medical student here at Macquarie University, and today I'll be giving you a brief overview of what it's like to be both a Macquarie MD student and an international student here at Sydney. So to start off, I just like to give you a short course structure, how the Macquarie MD course is being run. We've only had one cohort in our first year currently, so I can only give you a perspective from the first year medical student insight. So how it's run is we study the human body in system blocks. So take for example, currently we're doing cardiology. We would have lectures running for 3 weeks about the heart from all aspects, from specialists that they've invited from different hospitals and MQ Health. We would learn about the heart from the perspective of anatomy, physiology, pathology, and pharmacology, and all of that will be tied together through a few tutorials where we would practice. We would have clinical practice skills where we would learn how to do history taking and physical examinations, all about the cardiovascular system, and that would be also supplemented by wet labs where we would learn about the anatomy of the heart, dry labs where we would learn how to read the ECG, how to do stress testing, and that would all be concluded by the team-based learning that Professor McNeil mentioned before that we have every week. We also have this other course that's outside science with the physiotherapy students, so it's an interprofessional course where we would study about medical ethics and evidence-based healthcare, and that really sets the scene for potential placements when we go out from second year onwards. So two things that really struck out to me about the Macquarie MD would be the small cohort size and the supportive environment that we all study in. So it's really emphasized, so the small cohort is really emphasized here at Macquarie because that really encourages cohort bonding, and as mentioned, our cohort's really tight-knit, and we not only study together but we always have activities outside class with all of us where we go out for dumpling nights, movie nights, pub crawls, and potentially netball that's going to come up that hopefully you'll join us in for the upcoming years that you come in. And apart from that, being in a small cohort means that the student to teacher ratio is really nicely balanced, where we have about 6 to 8 students per tutorial, and that really helps you get fully engaged into the class where you get constructive feedback from not only the tutor but also from your peers, and everyone really gets to know each other's strengths and weaknesses, and we do help each other out through the learning process. And as I mentioned, the supportive environment that we study in, we not only have a great relationship within the student body, but between the lecturers, the academic staff, and the students, we all have this casual, friendly environment that we study and work together in, and that really helps us through our learning journey. And that's something that I find that Macquarie does really well, and it's not something that is expected from a university, and that's a really nice surprise because you know that whenever you have issues academically, emotionally, or financially, there's always someone to turn to. And so lastly, to wrap up, I'd just like to tell you a little bit more about being an international student. So I'm from Singapore, born and raised. Being in Australia is not a new thing for me because I did my undergrad in Melbourne, but coming to Sydney has been completely seamless because it's an English-speaking country. There's no problem with communication at all. Finding accommodation, trying to learn how to get around Sydney, and trying to set up phone bill, phone accounts and bank accounts. All of that's very seamless because being an international student is not a new thing that Sydney is exposed to. There's so many of us here, and if there was no problem for me, I don't think there would be a problem for you. And hopefully I've covered some, potential queries that you've had about being a Macquarie MD student. And if you have any other questions, please feel free to just type them in and we'll have them answered for you.
Great. Well, let's look at some questions. I know you've got lots of questions, so we're going to try and answer them for you. And just as questions come up, please send them through and we'll try and get to them as many as possible in the time we have available. Okay.
Hi, the first question that we have is from Lavender Carlo. She's asking, I'm an international student from Kenya. I have a biochemistry bachelor's degree from, I'm not sure how you pronounce that, Roanoke College, based in the USA. Do you guys have scholarships for international students?
We do have different countries' scholarships. So yeah, I'd have to confirm the exact amount. But yeah, each country normally has a country scholarship. So we can, I'm looking at my colleague over here from Macquarie International. We might address that one by email if that's all right, and we'll get back to you on that one. But thank you for the question.
So the next question is from Leanne Allen, and she's asking, can I do residency internship in the United States?
You can, it's a good question. So we will, in our degree, we'll provide some support for students to do the national exams in the US. So you'll be a foreign medical graduate for the US, and really we understand that to get into residency matching you need to have done step 1 and step 2 in your final year, and then you need to get a good recommendation. So that is why we have been working with getting exchange agreements with US medical schools, so that in your 4th year, if you want to do a selective and extended placement in the 4th year in a US academic medical school hospital, that will give you an opportunity to develop a relationship with the supervisor and get some references. So it's competitive to get into the US residency system. I've visited the US many times. I've lived in Boston for 3 years. I know the US system pretty well. But you will be in the pool with other foreign medical graduates from all over the world. But if you, with the opportunity to do part of your 4th year in a US school, that will give you a good chance.
Okay, we have a question now from James Bunker. How are communication barriers dealt with when completing placements in India? Do students run into this problem?
It's a good question. So India is an English-speaking country in terms of the universal language. There's many dialects and languages spoken in India, but English is in a sense a national language where people who come from different states can actually communicate. So it's also the clinical language in the Apollo Hospital. Nurses and doctors speak to each other in English. In fact, you'll often have nurses who actually don't speak the same language as doctors in terms of their local language, but all communication is in English. Many of the patients speak English, many don't. That's not dissimilar to an experience of an Australian medical student in some of our big hospitals in Sydney, where Australia is a very multicultural country and there's many non-English speaking Australian citizens in Australia. And so learning how to communicate with people whose first language is not English is actually a good skill to learn as a medical student. But the bottom line is in Hyderabad, English is the language spoken by your supervisors, by the nurses. We don't anticipate it to be a problem.
Okay, the next one is from an anonymous person. How many students will be in the program?
Yeah, well, 60 students per year. So when the program is fully operational, it'll be around about 250 students across the 4 years.
Okay, so another anonymous one. Can you speak a little about the Bachelor of Clinical Science program? Can I get an automatic entry into the MD?
It's a good question. Do you want to talk about that, Tanya, or do you want me to?
Yeah. So there is a direct entry pathway from the Bachelor of Clinical Science into the Macquarie MD program. This is available to up to 10 international students a year. For the Bachelor of Clinical Science, we're really looking for a high ATAR equivalent of 95. And we're also looking for maths and chemistry. So equivalent to HSC for band 4 level. So if you're great at maths and chemistry, this is definitely a good pathway to look at, and particularly if you're doing well in your high school studies. So yeah, it's a very good pathway. It is guaranteed, but we do set some requirements around the GPA and maintaining a high GPA of 5.5, and we do require the students to get 5.5 in the professional practice units. The professional practice units in the Bachelor of Clinical Science are those which help you communicate with patients and with healthcare teams and really work together as part of a team, and you learn professionalism, ethics, so some of the foundational knowledge that you'll need later on in a Doctor of Medicine program. So it's a very good pathway.
Yeah, so the Bachelor of Clinical Science is a fast-track program. It's 3 years. So in Australia, bachelor degrees are typically 3 years duration. I know in North America they're typically 4 years. In Australia, like the UK, bachelor degrees are 3 years. So the Bachelor of Clinical Science is actually 3 years of study that you take over 2 calendar years. And you do that because you do 5 units of study each session rather than 4 units of study, and you do an extra summer session. So it's high-powered, it's high-paced, but we found it's Australian students who do it really like it because they get to graduate medicine faster than their friends who study more traditional college degrees. So 2+4, if you get in, we do have an interview to get in to the 2+4 program, and as Tanya says, you're guaranteed to continue into the MD provided your academic performance in the Bachelor of Clinical Science is satisfactory.
We do actually have a North American student who's currently studying in our Bachelor of Clinical Science, and he's hoping to get into the MD. So yeah, it's a good pathway.
Okay, thank you. We have another anonymous one. What is the minimum score for the MCAT?
The minimum score for the MCAT is 500 overall and 125 in each section. So that's the minimum score.
Okay. So we have a question here from Raheel Dar saying, hi there, hello. So currently I don't exactly meet all the admissions requirements in terms of the MCAT cutoff. Would you still recommend that I apply?
We do set the minimum MCAT score because we find that students who meet that minimum score actually thrive in the program, and this is common with a number of medical programs in Australia. So the minimum is there to really support students to do well in the program. So, and it's not unusual for medicine applicants to take the MCAT a number of times until they get the right score. This is normal in medicine admissions. So we know this happens, and this is normal.
Yeah, I should say that the minimum is not necessarily the cutoff in terms of who gets selected. And for example, with the GAMSAT score, although we have a minimum, if we look at the average GAMSAT score that successful students get selected at, it's higher than that because it's competitive. We have many good applicants, and so that's the minimum. But you would want to do better than the minimum. So if you haven't achieved the minimum, probably that's going to be tough, to be honest.
Okay, the next one is another anonymous one. Are there any student groups in the med school that I should join?
Well, if you're a medical student, we have an active medical student society called MUMS, which is Macquarie University Medical Students Society. So it's, and as Queenie said, it's a very closely bonded student cohort. So it really gives a great student experience.
Okay, one from Isla Tego. Nice to see you there, Isla. We interviewed her recently. What is the process of becoming a practicing doctor in Australia after medical school?
Yeah, that's a good question. So in Australia, universities can't guarantee what's called medical internship or the first year of residency. that is controlled by the state governments in each of the states of Australia. In essence, international students have never been guaranteed an internship. The reality over the last 20 or 30 years, because in Australia, because we've had international medical students for quite a while across the 18 or 19 medical schools in Australia, international students have always got medical internship if they wanted it, apart from 2 or 3 years ago. But that is now changed. And so, for example, this year, 2018, every graduate of an Australian medical student, international or domestic, was offered an internship, and there was 41 unfilled residency places. So it can't be guaranteed, but the Australian government is put a cap on medical student places that they control, whereas the number of hospitals that require residents and interns is still expanding because the Australian population is expanding. I can't give you a guarantee, but I'd say that you have a very good chance as an international student of getting a medical internship in Australia if you graduate, next year, or I'd say for the next 5 years, unless something happens dramatic. But it's not in my control.
Okay, so Raheel Dar, there's another one from Raheel. As an international student, would I still be able to apply for residency in Australia?
Yes, well, residency, that's a visa issue. What's the answer to that one, Tanya?
Yeah, I mean, certainly in terms of the way that the system works is that if you have completed 3 or 4 year program, you do get a post-study work visa. I'm not a visa expert on this. I'm sure there are better experts, but certainly many international students do get the post-study work visa, which gives them an opportunity to work in Australia and then to subsequently apply for permanent residency. So that is an option. Obviously, there are no guarantees, and an agent would be able to advise you, a visa agent would be able to advise you on that. And certainly there's lots of information on the web.
Okay. One from Emma Mary Blackwood. Hello, Emma. Nice to see you here as well. You've mentioned there is a low student to professor ratio, and I'm sure that contributes to a good in-class environment. This may be specific, but what is the out-of-class support available to students in terms of understanding material, etc.?
Look, I think it's probably informal. There's a lot of peer-to-peer support is our experience, and you find that with small cohort sizes. We do have fairly strong non-academic support processes across Macquarie University. So students who have personal issues or health issues, as I said, part of MD Health is running our own family medicine practice. So you have personal health issues, they're very accessible. We have a member of the faculty staff whose job is just to liaise with students about non-academic issues. But if you're talking about academic support, the academics are always open to responding to emails or meeting with you and giving you support. That's part of their job. Yeah.
We also have a learning skills team, and they give students lots of support with writing essays, doing research, referencing, that kind of thing. So there is lots of support at Macquarie.
Okay, so one from an anonymous contributor. When is the deadline to apply for 2019?
The deadline is the 6th of October, but obviously it's best to apply as soon as possible because we do like to interview applicants quite quickly and to process applications quickly as well.
Another anonymous contributor, if a US student doesn't want to return to the US to practice, are they able to stay in Australia to practice?
Well, as Tanya said, you do have the opportunity to get a post-study visa for a period of time. It's not in our control, but so the reality is generally yes, you can. If you get a residency, you can then start Australian postgraduate training to an extent. Yeah. Yep. So it's not uncommon. Australia's pretty open in terms of medical professionals. Australia still imports more than 2,500 foreign trained doctors every year. So as well as international students study in our own universities, medical schools, Australia is a net importer of trained doctors from around the world. So there are opportunities, at least at the moment, but that's again outside the university's control.
Okay. Anonymous one again. Do you have an idea of competitive MCAT scores from past years for international students?
No, because this is the well, maybe from last year.
Yeah, we've got. I'm trying to remember actually last year's. Karen, I don't know if you can remember last year.
we only had a small international entry last year, so we've got limited experience.
Yeah, but I think if you've got a decent MCAT score, please apply.
Yes, if you have more than the minimum and your GPA is not so bad, so please apply.
I think that's all the questions for today. So.
Good. Well, hopefully this has been helpful for your considerations for Macquarie MD. Please send further questions to medicine@mq.edu.au if you have any, and we'll be happy to help.
Yeah, we will do. Thanks very much, everybody. Thank you.